Thank you, President Sampaio. Let me tell you all how honored I am to speak on behalf of our government, and I thank to the presence of Dr. Margareth Chan and the other distinguished ministers here in this audience. And thanks Mario Raviglione for this opportunity as well. Tuberculosis has a treatment and a cure. This consciousness, more than a phrase, has guided the development of the Brazilian Ministry of Health activities over the past years, such as the initiatives coordinated by the National TB Program. Brazil has pursued goals that have already shown satisfactory results, as we could share with the participants of the third Stop TB Partnership Forum, which we had the honor to host in Rio de Janeiro some days ago. Brazil is a signer of the Millennium Development Goals, which were approved by 191 countries of the United Nations in 2000, and which established commitment to the sustainability of the planet. One of the goals for 2015 is the reduction of the number of TB deaths, with the long-term goal of eliminating TB as a public health problem altogether. For 1990 to 2006, Brazil saw a decline in the rates of incidence and mortality of the disease, 26% and 31% respectively. Nevertheless, there were 72,000 new cases and 4,500 deaths reported last year. We believe that better living conditions of the poorest populations in our country have contributed to this decline. Even though there is a decreasing number of people living below the poverty line, this isn't enough, we do realize. The priority of the Brazilian government for TB control is reflected in more than 13 budget increase since 2002, from $5 million to $69 million in 2008. In December 2007, tuberculosis entered the program called More Health, also called Health Pact. It is a group of strategic activities and goals that are a benchmark for qualification and development in the area of health in the country. In 2008, the Ministry of Health resolved to adopt the treatment regimen for all Category 1 cases in the country with a so-called fixed-dose combination, which undoubtedly increases compliance, decreases patient defaults, and consequently increases the rates of success and cure, and thus preventing drug-resistant emergence. It is relevant once more the support of medical societies in our country, assuring no conflicts with private medicine. Over the past few years, the Ministry of Health has prioritized the expansion of DOTS and decentralization of TB control activities to the level of primary care, with emphasis on the strategic government program called Health of the Family. From 2001 until now, DOTS increased coverage from 7 to 70 of cases in the country. This prioritization can also be seen in the collaboration between TB and AIDS programs, with implementation of patient counseling for voluntarily test for HIV, and with the prevention treatment for all TB patients HIV seropositive. With these activities, we hope to impede interaction between the two diseases to prevent in Brazil the calamitous proportion of cases seen in other countries. At the same time, Brazil have invested in government responses as well as in energy and resources to increase civil society participation by engaging patient groups and other activists to take part in the guidelines discussions as well as in our decisions. Community mobilization is fundamental to early diagnostic and has brought about reduction in the default rate to less than 5% and increase in cure rate to more than 85%, indicators recommended by the World Health Organization, with Brazilian experts also utilized. Still in the area of social movement, the Brazilian government is decisively supporting participation of NGOs and other civil society organizations that permit TB control in the more vulnerable populations, such as homeless, those in prisons, and indigenous groups, and for which we have included specific activities in our national control plan. Recently, we were cited by WHO Director TB Program as a country that is following the right path for achieving an effective response to tuberculosis control, to be an example of a national response to the AIDS epidemic and a model for the world. Brazil is increasing its participation in international discussion forums as seen by the recognition of initiatives in TB control and the partnerships with other countries. We understand our responsibility to the international community. We have supported organizations like UNITAID that was formulated and implemented by the United Nations through initiatives in Brazil, Chile, France, Norway, and the United Kingdom. And today there are 29 countries supported by the Gates Foundation seeking complementary governmental actions. Brazil has also developed a web-based management information system for tuberculosis and for drug-resistant TB that incorporates cases and medicine management, and we are now offering this platform to other countries throughout the Stop TB partnership. Finally, we have worked with and sought new partnership with cooperation organizations that search for innovative solutions that combat all challenges. And in this sense, we emphasize the important activities we are fulfilling in collaboration with the Global Fund, the WHO, PAHO, the Union, USAID, and the Stop TB partnership, as well as the various with which we search for new agreements. With this clear political commitment, the outlook is even more plausible that the Millennium Development Goals for tuberculosis will be reached before the year 2015. For that reason, we expect that in a few years, Brazil will not be ranked anymore as a high-burden country with TB at all. We continue to confront the problem extensively, inclusively, always reaching for better TB control and searching for solutions to improve quality of life in reachable populations. Including the subject in our agenda signifies that Brazil's political promise, guaranteeing the possibility of a favorable, positive national response. To this, Brazil is dedicated, and on this path we will continue to move, combining forces to reach more and better health for our citizens. Thanks for your kind attention.